Hey everyone, and welcome to another deep dive here on Doc Fats. We're going to be taking a look at bedwetting today.
Ah, yes, bedwetting or nocturnal enuresis.
Yeah, that's the fancy medical term, right? Nocturnal enuresis.
Yeah.
We'll just call it bedwetting for today.
Yeah.
And we're basing this deep dive on the NICE Clinical Knowledge Summaries.
Yes, NICE
Are a
guidelines.
great resource for understanding and managing different conditions. And today we're going to try to unpack all the information that's in those NICE guidelines about bedwetting.
Mhm.
So to kick things off, let's just start with the basics. What is bedwetting? I mean, we all know it's, peeing in the bed, but when does it become a real medical concern?
Well, you're right that it's not always a cause for worry. It's perfectly normal for children under 5 to wet the bed.
Oh, really? Okay, so that's good to know.
Yeah. But when it continues past that age, that's when we might start to think a little bit deeper about it.
Okay, so it's not just about the age then. There's more to it than that.
Yeah, exactly. The DSM-5, which is like the handbook mental health professionals use to diagnose conditions, it lays out some specific criteria for diagnosing bedwetting. So it has to happen at least twice a week for 3 months and also cause significant distress to the child or have a real impact on their day-to-day life.
Okay, that makes sense.
Yeah.
So it's about the frequency, the distress it causes, and how much it disrupts their life.
Yeah,
Then it makes sense to look into it more closely.
right.
Okay. Now, I know there are different types of bedwetting, right?
Yes.
It's not all the same.
Yeah, that's right. NICE guidelines talk about 3 main types: primary bedwetting without daytime symptoms, primary bedwetting with daytime symptoms, and secondary bedwetting.
Okay.
And, distinguishing between these types is really important because it guides how we're going to assess and manage the situation.
Okay. Let's break those down one by one. So starting with primary bedwetting without daytime symptoms, what does that look like?
Well, in this type, the child has never really had a consistent period of dryness at night.
Okay.
They've basically been wetting the bed since they were little,
Mm-hmm.
but they don't have any problems during the day. So no accidents, no urgency, no frequency.
So it's just a nighttime thing.
Yeah, it's a consistent issue, but just at night.
Okay. So what could be causing this type of bedwetting?
Well, one of the common culprits is actually chronic constipation.
Oh, wow.
Yeah.
I would not have guessed that constipation.
Yeah, I know it sounds strange, but
Yeah.
a full bowel can put pressure on the bladder, making it harder to hold urine.
Oh, okay. That makes sense.
And that leads to those nighttime accidents. So it's always worth checking for constipation in these cases.
That's fascinating. Okay. So constipation, what else could be going on?
Well, some kids also have difficulty waking up from sleep,
Yeah.
even when their bladder is full.
Oh, so they're just sleeping too deeply.
Yeah, it's like their brain is not getting the signal that, hey, it's time to
Oh,
go.
wow. Okay. And then some kids might actually produce more urine at night
Yeah,
than their bladder can handle.
exactly.
All right. So we've got constipation, sleep issues, and producing too much pee at night.
Mm-hmm.
Now, what about primary bedwetting with daytime symptoms?
So this is where things get a bit more complex because in addition to bedwetting, the child is also experiencing some bladder symptoms during the day. So they might have urgency,
Okay.
frequency accidents, or trouble fully emptying their bladder. It's like their bladder control is a bit off both day and night.
Okay, so it's not just a sleep thing or a pee volume thing. So
Right.
what else could be going on in those cases?
Well, there's a whole range of possibilities here.
Oh,
It
yeah.
could be an overactive bladder where the bladder muscles are just squeezing too much, or there might be some structural abnormality in the urinary tract.
Mm-hmm.
Sometimes it's related to a neurological condition
Okay.
that affects the bladder control. And of course, we can't forget about ITIs. And even chronic constipation can be factors here as well.
Wow. So many different things to consider.
Yeah,
It seems like it's a real detective work to figure out what's behind those daytime and nighttime accidents.
absolutely.
Okay, so we've covered the 2 types of primary bedwetting. Now, what about secondary bedwetting?
Secondary bedwetting is when a child starts wetting the bed after at least 6 months of being dry.
Oh, so they were dry.
Yeah, so they were doing great, and then suddenly, bam, the bedwetting starts again.
Wow, that seems like a real head scratcher. Like something must have changed.
Yeah, you're right. It often indicates that there's some underlying issue or trigger that needs to be addressed.
Okay, so what kind of things might cause this sudden resurgence of bedwetting?
Well, it could be a medical condition like diabetes
Okay.
or a UTI.
Uh-huh.
Constipation can also be a culprit, even if they haven't had problems with it before. And sometimes it's linked to psychological factors
Yeah.
like stress, anxiety, or even problems within the family.
Oh, wow. So really a whole range of possibilities.
Yeah.
So secondary bedwetting is like a detective case.
Mm-hmm.
We need to gather clues to figure out what's going on.
Exactly.
Okay. So now before we get into like the management of bedwetting,
Mm.
I'm curious, how common is this actually?
You might be surprised to learn that bedwetting is actually very common. It affects about 5 to 10% of 7-year-olds
Wow, that's a lot more common than I thought.
and still impacts 1 to 2% of adolescents.
Oh, wow.
Wow.
So it's not something to be ashamed of at all.
Yeah.
If you're dealing with this, you're not alone.
Absolutely not.
And here's a statistic that I found from the guidelines that was kind of surprising to me. 7 out of every 100 children who wet the bed at age 7 may continue to experience it into adulthood.
Yeah, that's an important point. It highlights that it's not just a fleeting phase.
Yeah.
And addressing it early on is really important.
Absolutely. So it's not something to just ignore.
Right.
We need to actively think about it. Okay.
Yeah.
Now, I'm guessing it's not just about changing the sheets, right? What kind of impact can bedwetting have on a child's life?
It's not just about the practicalities of laundry and stuff. Bedwetting can have a big impact on the child's emotional, social, and behavioral well-being.
Oh, that makes sense.
Imagine, feeling ashamed, guilty, different from your friends, especially at an age when fitting in is so important.
Yeah.
So it can really affect their self-esteem and social life. My heart breaks just thinking about a child going through that. And I can't imagine it's easy for families either.
No, it's really tough on everyone involved.
Yeah.
The NICE guidelines talk about the stress that families face, from the practical challenges of managing the bedwetting to the financial burden of constantly replacing bedding and clothes. And sadly, some parents resort to punishment, which, is never the right approach.
Yeah, that's just going to make the child feel worse.
Exactly. It's never the child's fault, and punishment will only make the situation worse.
For sure. So speaking of addressing the problem, let's talk about what happens when you go to a healthcare professional with concerns about bedwetting. What's the assessment process like?
Well, the first step is to determine what type of bedwetting we're dealing with.
Okay.
Because as we've discussed, that really guides our approach. So we start by gathering a detailed history, asking questions about the pattern of bedwetting.
So it's like detective work again.
Yeah, exactly.
Okay. What kind of questions do you ask about the bedwetting pattern?
We'll ask about the frequency.
How many nights per week does it happen? How many times a night if they know? How much urine is produced each time?
Okay, so really detailed information.
Yeah, and we're also interested in any daytime symptoms.
Huh?
Like, that urgency frequency accidents that we talked about.
Okay.
And because sleep can play a role, we'll also inquire about sleep quality.
Oh, yeah, that makes sense.
So questions like, do you snore? Do you have any pauses in breathing during sleep? That sort of thing.
Okay.
To see if there might be any underlying sleep issues contributing to the bedwetting.
So it's like putting together a puzzle, looking at all these different pieces.
Yeah, exactly.
Right.
We also want to know about fluid intake,
Yeah.
particularly in those hours leading up to bedtime.
Uh-huh.
So that big glass of water right before bed might not be the best idea.
Okay. So maybe adjust the timing of the fluids.
Yeah.
What else?
We'll want to get a sense of the home environment.
Okay.
So is there easy access to the toilet at night? Do they share a bedroom? That sort of thing.
Okay. So not just what's happening inside the body,
Yeah,
but also their surroundings.
exactly. And then it's really important to understand the child's and family's concerns and goals.
Oh, right.
Why are they here today? What are they hoping to achieve? Are they looking for reassurance or are they looking for active treatment?
Yeah. So everyone's on the same page.
Exactly.
Okay. Now, for children under 5, the assessment might also include checking for constipation, right?
Yes, absolutely. Because as we discussed, a full bowel can really impact bladder control. So it's
Right.
always something we consider.
Good point. Now, what if we're dealing with primary bedwetting with daytime symptoms?
Yeah,
Does the assessment change at all?
it does. In these cases, the focus shifts to exploring those daytime symptoms in more detail. So we'll ask about how often you feel the urge to pee during the day, how strong is the urge, do you ever leak urine, how many times a day do you actually go,
Yeah.
that sort of thing.
So really understanding that daytime bladder pattern as well.
Exactly. And we'll still want to look at fluid intake and rule out any potential medical conditions like constipation or UTIs.
Yeah, so still looking for those underlying causes.
Mm-hmm.
That could be contributing to both the daytime and nighttime wetting.
Yeah. Okay. Now, what about assessing secondary bedwetting? How does that differ?
Well, since secondary bedwetting usually indicates an underlying trigger,
Okay.
the assessment is really about trying to figure out what might have caused this change in bladder control.
Oh, so it's like going back in time.
Yeah, exactly.
Trying to figure out when things shifted.
Exactly. So
Uh-huh.
we'll ask when the bedwetting started, how often is it happening,
Mm-hmm.
how much urine is produced,
Mm-hmm.
and are there any other symptoms present?
Okay. So similar questions, but with a focus on that change over time.
Yeah, and in addition to those questions about fluid, sleep, and the home environment,
Yeah.
we'll also ask about any recent changes or stressors in the child's life.
Oh, that's interesting.
Yeah,
Because that could be a trigger.
exactly.
Yeah.
You know, things like starting a new school, moving to a new house, or dealing with family issues.
Yeah, big life changes.
Yeah, exactly. Okay. Now, we talked earlier about healthcare professionals being aware of potential child maltreatment.
Right.
Does that factor into the assessment process for secondary bedwetting too?
Absolutely. Because while secondary bedwetting is not always a sign of abuse or neglect,
Yeah.
it's something we always keep in mind, especially if there are any red flags present.
So what kind of signs would make you concerned about potential maltreatment?
Well, the NICE guidelines specifically mention deliberate bedwetting,
Okay.
punishment by parents for bedwetting,
Mm-hmm.
and secondary enuresis that doesn't respond to any of the management strategies we try.
Okay, so things that just don't seem to make sense.
Yeah,
Or that raise some red flags.
exactly. And if we suspect child maltreatment, we're obligated to follow safeguarding procedures and involve the authorities.
Yeah, that's a really important role that healthcare professionals play
Absolutely.
in protecting children. Okay. Now, before we move on to the management recommendations, I have a comment about urinalysis.
Mm-hmm.
We talked about how it's not always necessary, but are there any situations where you definitely recommend it?
Yes, you're right. It's not a routine test for all cases,
Okay.
but there are certain situations where it's warranted. For example, if the bedwetting started very recently,
Okay.
if there are daytime symptoms, or if the child is showing signs of being unwell,
Okay.
we'd likely recommend a urinalysis.
So using it strategically to rule out other potential issues.
Yeah, exactly.
Makes sense. Okay. So I think we're ready to move on to the part that everyone's probably most interested in,
Mm-hmm.
managing bedwetting. Now, we touched on this briefly earlier. We mentioned enuresis alarms and desmopressin.
Right.
But before we dive into specific strategies, let's talk about the general approach recommended by the NICE guidelines.
Yeah. The guidelines really emphasize the importance of reassurance and education.
So before we jump into any treatments, we need to make sure everyone understands what's going on.
Exactly.
Hmm.
Both the child and the family need to understand that bedwetting is common and that it's not their fault. We want to bust any myths about bedwetting and encourage healthy habits that can support bladder control.
Okay, so creating a supportive environment.
Yeah.
What kind of healthy habits are we talking about?
Well, things like a balanced diet,
Uh-huh.
adequate fluid intake,
Okay.
regular toileting during the day, and avoiding things like caffeine before bedtime.
Okay. Those all seem pretty reasonable and manageable.
Yeah.
And I'm guessing you're not a fan of that whole just hold it all night approach.
No, definitely not. Restricting fluids can actually backfire.
Yeah.
And make things worse in the long run.
Okay, good to know.
Yeah.
What about waking the child up during the night to go to the bathroom? Is that recommended?
No, the guidelines actually advise against lifting and waking the child
Okay.
for those nighttime bathroom trips.
Interesting.
While it might seem helpful in the moment, it doesn't really help them develop bladder control,
Okay.
and it disrupts everyone's sleep.
So resisting that urge to wake them up
Yeah.
is better in the long run,
Right.
even if it means a few more accidents.
Yeah.
Okay. What about reward systems? Are those helpful?
Positive reinforcement is always a good idea.
Yeah.
It can help motivate and encourage the child,
Ah.
but it's important to focus on rewarding the desired behavior, like using the toilet before bed or having a dry night, rather than punishing accidents.
Oh, yeah. That makes sense. Focusing on the positive.
Yeah.
Okay. So we want to create a supportive environment, not one filled with shame and blame.
Right.
Now let's dive into those specific management strategies.
Okay.
Starting with enuresis alarms. Can you explain how they work and why they're considered like the first-line treatment for certain types of bedwetting?
Sure. So enuresis alarms are these devices that have a sensor pad.
Okay.
And the pad can be placed in the child's underwear or on the bed.
Uh-huh.
And when the sensor detects moisture, an alarm goes off, waking the child up.
So it's kind of like a high-tech version of those old-school bells
Yeah, exactly.
people used to put on their doors. But what's the goal here? Is it just to wake them up in the middle of the night?
The goal is actually to train the child to recognize the feeling of a full bladder and to wake up before they wet the bed.
So it's like retraining their brain
Yeah, exactly.
to pay attention to those signals. That's pretty amazing.
Yeah.
that technology can do that.
Yeah, it's really helpful.
Are there any downsides to using those alarms?
Well, they can be a bit disruptive to sleep, not
Hmm.
just for the child, but for the whole family.
Yeah, that makes sense.
And it takes consistent use for several weeks or even months to see results.
Okay.
So you need to be patient and consistent.
Okay, so it's not a quick fix, but it's a good long-term solution.
Exactly.
Okay. Now, what about desmopressin? How does that work? When would you typically recommend that?
Desmopressin is a synthetic hormone that reduces urine production at night.
Okay.
So it can provide rapid improvement or short-term control, like for sleepovers, for example.
Oh, that's great.
Mm-hmm.
But I'm guessing it's a medication, so it probably has side effects.
Yeah, you're right. It's important to use it carefully and under the supervision of a healthcare professional.
Of course.
There are some potential side effects, and we need to be mindful of those.
Okay, so it's not something to just take lightly.
No, definitely not.
All right. Now, before we wrap up this part of our deep dive, I want to make sure we highlight some resources and support groups that are out there for families who are dealing with bedwetting.
Yeah, absolutely. So there's a great organization called ERIC, which stands for Education and Resources for Improving Childhood Continence.
Okay,
They have a website and a helpline,
that's awesome.
and they provide tons of information and support to families.
Great. So it's good to know that there are people out there who understand what you're going through and that there's help available.
Exactly.
Okay. Well, we'll make sure to include all that information in the show notes for you. So anything else you want to add before we move on to the next part of our deep dive?
Just want to reiterate that bedwetting is common and treatable. There's no shame in seeking help. And with the right management strategies, children and families can overcome these challenges.
That's a wonderful message to end on. We've covered a lot of ground today, but there's still so much more to learn. So stay tuned for part 2, where we'll dive deeper into the NICE guidelines and really unpack those specific management recommendations for each type of bedwetting.
Looking forward to it. Welcome back to our deep dive on bedwetting.
Okay, so let's pick up where we left off.
Yeah, we were talking about the assessment process, right?
Yeah, so let's imagine you're a parent and you're going to the doctor with concerns about your child wetting the bed. How does that conversation even start? What happens?
Well, the first thing is to figure out what type of bedwetting we're dealing with.
Right, because we talked about those 3 different types.
Exactly. So let's start with primary bedwetting without daytime symptoms. So you've got a child who's been consistently wetting the bed, but they don't have accidents during the day. What kind of questions do you think the doctor might ask?
Well, I guess they'd want to know, like, how often it happens.
Exactly. That's one of the first things we ask about. The frequency of the bedwetting. How many nights a week does it usually occur?
Okay.
And we'll also want to know if it happens more than once a night and how much pee is produced each time, if they know.
Okay, so like really getting a detailed picture of what's going on.
Yeah, it's like keeping a bedwetting diary.
Okay. Then what?
We'll also ask about sleep quality.
Oh, yeah, that makes sense.
So we might ask things like, do you snore? Do you have any pauses in your breathing while you're sleeping?
To rule out things like sleep apnea.
Exactly.
Okay.
And we'll also want to know about their fluid intake, particularly in the evening.
Yeah, because I was thinking like maybe drinking too much before bed could be a problem.
It definitely can be. So we'll ask about what they're drinking and when they're drinking it, especially in those hours leading up to bedtime.
Makes sense.
Yeah.
So besides sleep and drinks, what else might the doctor ask about?
We'll also want to know about the home environment.
Oh, interesting.
So things like, is there a clear path to the bathroom at night? Is the toilet easy to access? Do they share a bedroom?
Okay, so it's not just about what's happening inside their body.
No, it's about looking at the bigger picture.
Yeah.
And we'll also talk about the reason for their visit.
Okay.
What are their goals for coming in? Are they looking for reassurance? Are they looking for specific treatments?
So everyone's on the same page.
Exactly.
Okay, now for kids under 5, the assessment might also include checking for constipation, right?
Yes, always good to check for constipation because, as we discussed, that can really impact bladder control.
Yeah, that was a surprising connection.
It is a bit surprising, but it's something we always keep in mind. Okay, now what if we're dealing with primary bedwetting with daytime symptoms? Does the assessment change at all?
I would imagine so.
It does. We'll still ask about the bedwetting, but the focus shifts more to those daytime symptoms.
Okay.
So we'll ask things like, how often do you feel the urge to pee during the day? How strong is the urge? Do you ever have accidents? How many times a day do you usually go?
So really trying to understand that daytime bladder pattern as well.
Exactly. And we'll still want to rule out any medical conditions like UTIs or constipation
Yeah.
and look at those fluid intake patterns.
Okay, so still looking for those underlying causes.
Yeah. And we'll also want to know how those daytime symptoms are affecting the child's life.
Yeah, that makes sense.
Yeah.
I can imagine that's tough.
It can be. Okay, now what about secondary bedwetting? How does that assessment process differ?
I'm curious to hear about that.
Well, since secondary bedwetting is often triggered by something, the assessment is really about trying to figure out what might have caused that change.
Oh, so it's like detective work again.
Yeah, going back in time and trying to figure out when things shifted.
Okay.
So we'll ask when the bedwetting started, how often is it happening, how much urine is being produced, and are there any other symptoms?
Okay, similar questions, but really focusing on that timing and potential triggers.
Right. And we'll also ask about any recent changes or stressors in the child's life.
Oh, that's interesting.
Yeah, things like starting a new school, moving to a new house, dealing with family problems.
Big life changes.
Yeah.
Okay.
And of course, we'll always ask about those things we talked about before, like fluids, sleep, and the home environment.
Right.
But with secondary bedwetting, it's really about trying to find that trigger.
Makes sense.
Yeah.
Now, we talked earlier about healthcare professionals being aware of child maltreatment.
Right.
Does that play a role in the assessment of secondary bedwetting, too?
It does. While secondary bedwetting is not always a sign of abuse,
Okay.
it's something we keep in mind, especially if there are any red flags.
So what kind of red flags are we talking about?
Well, the NICE guidelines specifically mention things like deliberate bedwetting punishment for bedwetting by the parents and secondary enuresis that doesn't respond to treatment.
Okay, so things that are unusual or concerning.
Exactly. And if we suspect child maltreatment, we're obligated to follow certain procedures and report it to the appropriate authorities.
Okay, so another important role that healthcare professionals play.
Yeah, absolutely.
Okay. Now, before we move on to management, I have a question about urinalysis. We talked about how it's not always necessary.
Yeah.
But are there any times when you would definitely recommend it?
You're right. It's not a routine test for everyone,
Okay.
but there are times when it's a good idea. For example, if the bedwetting is a very recent development, if there are also daytime symptoms, or if the child is showing signs of being unwell, then we'd probably do a urinalysis.
Okay, so strategically using it to rule out other problems.
Exactly.
Okay, so I think we're finally ready to talk about managing bedwetting.
Okay.
Now, before we get into those specific strategies like the alarms and the medication,
Yeah,
can we talk about the general approach that's recommended?
sure. The NICE guidelines really stress the importance of reassurance and education.
So before jumping into treatment, making sure everyone understands what's going on.
Yeah, we want to reassure both the child and the family that bedwetting is common, that it's not their fault.
Yeah.
And we want to encourage healthy habits that can support bladder control.
So creating that positive and supportive environment.
Exactly.
What kind of healthy habits are we talking about?
Well, things like a balanced diet,
Okay.
making sure they're drinking enough fluids throughout the day.
Okay, not restricting fluids.
Right.
Okay.
Having a good toileting routine during the day and avoiding caffeine before bed.
Okay. Those are all good things to keep in mind.
Oh.
What about waking the child up at night to go to the bathroom?
The NICE guidelines actually advise against that.
Oh, interesting.
While it might seem helpful in the moment, it doesn't really help them develop their own bladder control,
Okay.
and it can disrupt everyone's sleep.
So letting them sleep through the night
Exactly.
is better in the long run,
Right.
even if it means a few accidents.
Yeah.
What about reward systems?
Positive reinforcement is always a good thing.
Okay.
We want to encourage the child and celebrate their successes,
Okay.
but it's important to focus on rewarding the desired behavior like using the toilet before bed or having a dry night and not punishing them for accidents.
Yeah, that makes sense. Okay, so now let's dive into those specific management techniques,
Okay,
starting with enuresis alarms. Can you remind us how those work?
sure. So enuresis alarms are these devices that have a sensor pad,
Mm-hmm.
and the pad can be placed in the child's underwear or on the bed.
Okay.
And when the sensor detects moisture, an alarm goes off, waking the child up.
Okay, so it's like that high-tech bell we talked about.
Yeah.
But the goal isn't just to wake them up, right?
No, the goal is to help them recognize that feeling of a full bladder and wake up before they wet the bed.
So it's like retraining their brain.
Exactly.
That's pretty neat.
Yeah.
Okay, are there any downsides to using these alarms?
Well, they can be disruptive to sleep for the child and the family.
Uh-huh.
And they do require consistent use for several weeks or even months to see results.
Okay, so patience and persistence.
Exactly.
Now, what about desmopressin? When would you recommend using that?
So desmopressin is often an option if the alarm isn't working or if the family needs a more immediate solution, like for a sleepover or something.
Okay, so a short-term fix for specific situations.
Yeah, but it is a medication, so it's important to use it carefully under the supervision of a healthcare professional
Okay.
and to be aware of the potential side effects.
Now, before we wrap up this part, are there any resources or support groups you recommend for families dealing with bedwetting?
Yeah, absolutely. There's an organization called ERIC, which stands for Education and Resources for Improving Childhood Continence.
Okay.
And they have a ton of information on their website and a helpline
That's fantastic.
where families can get support and advice.
Great. So good to know that there's help out there.
Exactly.
Now, before we move on to the last part of our deep dive, I have a question. Could there be a connection between bedwetting and urinary tract infections later in life?
That's a great question, and it's something that researchers are definitely looking into.
Okay.
We know that UTIs can sometimes cause secondary bedwetting,
Yeah.
but could it work the other way around? It's an interesting area for future research.
Yeah, that is really interesting. It just shows how important it is to take bedwetting seriously and address it properly.
Absolutely.
All right, so stay tuned for the final part of our deep dive where we'll wrap up our discussion on bedwetting. All right, so welcome back to the final part of our deep dive into bedwetting. We've covered a lot of ground.
We have, from those different types to all those management strategies.
Right. It's been a journey through bedwetting land.
Guided by those fantastic NICE Clinical Knowledge Summaries, of course.
Of course,
Oh.
always evidence-based here.
Yeah?
So as we wrap things up today, I want to go back to something we talked about earlier, the impact of bedwetting on kids and families.
Yeah, that's such an important aspect. It's not just about the practicalities. It's really about the emotional and social well-being of the child.
Exactly. I mean, imagine being a child who feels ashamed and guilty about wetting the bed.
Especially at that age when fitting in is so important.
Right, like sleepovers and camp.
Exactly. It can really make them withdraw and avoid those social situations.
And I can't imagine how tough it is for the families either.
No, it's definitely stressful for everyone involved.
So what can families do to create a more positive and supportive environment?
Well, I think communication is key. Talking openly about bedwetting and letting the child know that it's not their fault.
Right. No shame, no blame.
Exactly. And practical things like having easy access to the bathroom at night and using waterproof mattress protectors can help reduce stress.
Yeah, those are all good tips. And I think it's important for healthcare providers to remember that too.
Absolutely. We need to approach bedwetting with sensitivity and empathy.
And we talked about a lot of resources and support groups for families.
Yeah, like Eric in the bladder and bowel community.
Right, those are great places to find information and connect with others who understand what you're going through.
And the NHS website also has a lot of helpful information.
Okay, so definitely check those out if you need more support.
Absolutely.
So as we wrap up our bedwetting deep dive, what are your final thoughts for our listeners?
Well, I think the most important message is that bedwetting is a common problem.
Yeah, we said that a lot, but it's worth repeating.
It really is. And it's treatable. There are effective solutions out there, so if you're struggling, don't hesitate to reach out for help.
Great advice. And remember, it's not the child's fault. Patience and understanding are so important.
Absolutely.
Well, thank you so much for joining us for this deep dive into bedwetting. We hope you found it informative and helpful. And remember to check out those show notes for links to all those fantastic resources we mentioned.
Thanks for having me.
And until next time, stay curious and keep learning.